Hi, this is Dr. Roger Smith. Let's talk about the stomach virus and managing all the issues related to that in your children. And so it's something that every parent deals with. I've known no children have not had a stomach virus at some point, and the parents had to deal with all the issues. And it's quite humorous at times to listen to parents try to explain what's going on with their child. And there are terms that you have grown up with, maybe that in your family meant something, but whenever it comes into a medical office, the terms don't necessarily tell us what's going on. My stomach is tore up. I've got an upset stomach. There are phrases that you use that don't tell us exactly what's going on. And so I encourage you to begin to give some specifics as to what it is that you're seeing in your child. They are throwing up. They are having diarrhea, or they're having frequent bowel movements, liquid bowel movements, and being as specific as possible really helps us to help you. And so I want to deal with the 4 Ds in dealing with the stomach virus, and they are dehydration, there is the discomfort of it, the mess, and the dissemination. And so we're going to walk through those things and some things that you need to consider and some tips to managing in each one of these. And so the first issue that parents get concerned about, and we are concerned about as well, is the issue of potential dehydration, because that is where the child can get into trouble. And so quite honestly, children are much more likely to get dehydrated from diarrhea than from vomiting. And so quite often it seems like there's a lot of volume coming out whenever a child vomits and vomits repeatedly. And so it's helpful to take some notes, parents. Find you a notebook of some sort. Make some notes of when did they vomit, what was it like, how many bowel movements, and so in the intensity of the illness, it seems to wear us down, and we begin to exaggerate because we want some relief. And so the specifics actually help us to make decisions. So vomited at 2 a.m. Now that may be one episode of vomiting, and maybe they vomit again at 3. But if someone vomits at 2 and then before they leave the bathroom have to go back and vomit again, that's not 2 episodes, that was 1. And so it was just that it was incomplete. And the same goes for diarrhea. If it's you get up and they're leaving and they got to go back, that's not 2, that's still 1. And so making notes of those things will help us to make decisions. So, and also what other symptoms are going on, whether there's fever, there's rash, there's pain. And so making notes of that really helps you to be more specific whenever you take your child to get medical care. And so dehydration, some of the early signs are that their mouth will be dry, that they'll quit producing urine. Now, if they're having diarrhea, it's hard to tell if they're passing water from the bladder or if it's in the stool. So, but they'll have dry eyes, dry mouth, and certainly if they get to the point that it's serious, it will begin to affect them mentally and energy-wise. And so we see a child that becomes more weak and limp. And not just limp whenever they're having fever, but whenever they're in between having episodes of fever. Are they up running around? That's a good sign. If they're laying around and they just look like a limp dish rag, then that should get our attention and cause more concerns. So quite often, parents want to replace those fluids as quickly as possible. You know, they vomit, so we got to give them something to drink. And that actually is not a good idea. If the body is trying to eliminate something by vomiting, you put something immediately in its place and it's going to try to eliminate that again. So just use some logic here. So when we replace fluids, we give small amounts, even in volumes of teaspoons at a time. So if the stomach is emptying itself, allow it to remain empty. Now, you can carry that to an extreme, but in general, don't try to force fluids if a child is vomiting, because you're just asking for more trouble. So that's the dehydration issue. What about the discomfort aspect? Well, when we treat a child that is having fever, we're not necessarily trying to treat the fever, because this fever has actually biologic benefit, but there is a pain and discomfort that comes along with it, and the medicines that we use for fever also help to relieve the general discomfort. And so the medicines have to be repeated, and also make sure that you're using the proper dose for whether it's Tylenol or whether it's ibuprofen that you're using for the discomfort. Make sure that you dose it by the weight chart that's on the container. And there are different strengths of the medicines, so make sure that you're reading from the right bottle. We've also had people dosing from a prior bottle, and the new bottle was a different concentration, and they were either given too much or too little. So, if they're having fever, sometimes you don't want to bundle them up. You want to have them lightly clothed so that their body can eliminate some of that heat. So, naturally, not to the point of them chilling or having chills. If they're shaking or having chills, then you've gone a little bit too far on that. You need to let them warm up. So what are some tips with dealing with the mess? The mess, that's the third D. And so when a child's vomiting, it sure is frustrating when they vomit in the bed, they vomit on their clothes, they vomit on you, and oftentimes we want to give them a container to vomit in, and they miss it. So here's a little tip from a hospital. We have things to help people that are vomiting to catch their what we call emesis, or what's coming up. And you can use something as simple as a grocery bag, and I'll show you how to make something that we use at the hospital. And so you get one like this, and you can cut the top off of it so that you don't have the arms on it, you just have the bag. And you take something like a drinking cup. This is a clear plastic one. This is good because it's a little sturdy. You don't want a paper cup because it'll get crunched down. This holds its shape. Cut the bottom off of it. Okay, so I just cut this part off of this one, and then I took the bag and I attached the bag to the cup with some tape. This has to be duct tape, but any kind of tape works. And so a child can hold this, and if they're going to vomit, they can put it up to their face, and it sure is easy to hit that, and it contains it. The other thing is, it helps you to know how much they're vomiting, because when they are vomiting into a toilet or into a trash can, or it gets all over the clothes or the bed, it looks like a lot, but when you catch it and you see it, it's really not as much volume as you think. So it helps you to not panic as a parent, thinking that they're losing tons and tons and tons of volume. So now, whenever you have to clean up a child and you have a sensitive stomach, you can use something as simple as a bandana and put some type of fragrance on it that is pleasant to you, and you can actually put it on, and so that it obstructs or blocks some of the odors of the emesis or the diarrhea or things. So it can help you to manage what you've got to face if you have a very sensitive stomach. So that's some of the things with the mess. Well, what about dissemination, or the spread of this illness? Usually these are caused by viruses, and viruses in the GI tract are usually spread by hand contact. And so it's not what's in the air. You don't have to spray the room with any kind of disinfectant because the infection is in the fluid, and you get it on your hands, and you wipe your nose, scratch your eye, or eat, and then you basically take it into yourself or give it to another person that way. So anytime you handle some of the mess, make sure you wash your hands before you touch your face. Okay, so if you're putting on makeup, you want to make sure you wash your hands if you have a sick child before you start putting on things on your face or around your mouth. Brushing your teeth, any of those things, wash your hands, because it's disseminated usually by hand contact. And we can actually get it on items like the doorknobs of telephones and things like that. So, clean those. And I'm not saying be hyper vigilant, but general good common sense. But if you keep your hands clean, you generally can keep it out of your body. So those are some things to consider. That's the dehydration aspect. That is what is it? The discomfort of it, the mess, and the dissemination. And so those are some things to consider when your child has the stomach virus, or what is really known as gastroenteritis. And so usually caused by a virus. If the illness goes on and your child is not recovering after a day or two of you doing common sense types of things, you should have them evaluated. It could be something else. And certainly if pain is a prominent feature, consider that it could be more than just a simple stomach virus. Now, as they're getting better, you do have to reintroduce food. And so we have a very simple description of foods that you can start with, and we call it the BRAT diet. And it stands for banana, rice, applesauce, and toast. And they're just bland foods that are easy to digest. There's nothing magical about those, but those are easily digested and they're bland, and you can gradually increase back to their normal diet. So those are some things to consider, and hopefully this has been helpful. This is Dr. Roger Smith with Parenting Matters Now.